I wanted to ask you if you could say more about this pentad or septad,
Yeah.
the common conditions that you see in, say, the complex chronic disease community. And then I love that you then kind of segued into the deep dive on an individual patient. Like just because the average person has these seven things, they're going to be reflected differently in every
Absolutely.
single person.
That's an excellent point. So if anyone listens to my podcast with Dr. Kaufman, we talk about the septad diagnoses, or even when we refer to it as peptad or decatad
I
these
know
days.
it's getting
I
bigger.
know it just continues to increase. We refer to it as a roadmap. And
Okay.
it really is a roadmap. And we like it as a roadmap, especially for doctors who are not yet as familiar as we are with this patient population, because it gives other doctors an idea of where to start, of like how to, what to treat first. And
Hmm.
sometimes based on those diagnoses, you can ask the patient, what is your most prominent symptom that's really impacting your quality of life on a daily basis? And if you can take that symptom that they report back and put it into one of those diagnoses, and that's where you start. That's what you treat
Hmm.
first. And very often it's the autonomic symptom or it's the mast cell symptom. So the most
Right.
common places to start are either the POTS or the MCAS. Now, POTS is sort of, a surface description of an autonomic problem. But there's treatment for it. So it is a good place to start. I fully admit that. So you either start with POTS or MCAS most commonly. Oftentimes, the reason behind the POTS or the MCAS is an infection or other exposure. And so if you
Hmm.
identify what that is, you can treat that exposure, whether it's with antibiotics for, a bacterial infection or antivirals for a viral infection or some of the new monoclonal antibodies that are out. Or even if it's another exposure, things like, of course, mold is very common, and people treat it right. And it's
Yeah.
also important, I will say that I'm not literate in treatment of tick-borne disease. I mean, I've learned a lot from Dr. Kaufman. I fully admit
Hmm.
that, but I still defer to doctors like him who are well more versed in the different antibiotic options, certainly. And then I'm definitely not literate in mold treatment. So, I try to focus in on the neurological aspects of
Right.
their symptoms because that's who I am and what I do best. And I don't think it's fair to patients for me to just to try to treat something that I'm not completely comfortable with. I mean, I sort of know where to start if I have to, but when they don't respond, I don't know where to go from there. So I usually defer to doctors who are a lot more literate in
Hmm.
those kinds of exposures. But the point being is that if it's an exposure-driven symptom that even though it might sit in the house of MCAS or in the house of POTS, then you still want to treat it as MCAS or POTS, but you do have to get to the root of why that happened and treat that as well. Unless it's been so chronic that sometimes you just got to treat what has happened as a consequence of that exposure first and foremost. Otherwise, recovery can be impaired or not full.